Hi, I am Dr. Julie Brown, your concussion doctor, board-certified chiropractic neurologist, and fellow in traumatic brain injury and rehabilitation. And I want to talk about pain today. There are so many ads, so many commercials for pain medications, and these pictures of these people living glorious lives once they take these medications, and the world changes, and that's really not true. I can't prescribe medication, it's not in my scope, but I really have to understand these medications that people that are on when they come into my office. I need to know the effects on the brain, on the tissue, how they live their life when they're on it because they can't feel the pain, so they think they can go run marathons, whatever it may be. But pain is there to tell us that something is wrong, something is not right in our body. And we want to address it. We want to look and say, hey, does that disc have pain because there's a herniation or a protrusion in there and there's local inflammation? Is it because they keep doing this twisting motion at work, or they did something in their spare time, water skiing, and hurt themselves? Pain tells us what's going on, and I follow it a little bit. It goes in the big picture of what's going on with you, along with my physical exam, along with what medications you're taking or not taking. And then we want to approach it and say, how can we address where the problem is because you have pain and the body's telling you that? And how do we pay attention to pain levels as to how we're helping you? When you take a pain medication, it typically works centrally on the nerves to block and say, hey, to not tell the brain, there's no pain, we don't see anything going on in here. Or at the end organ, say you take Advil or something, and or an ibuprofen of some sorts, and you have a burn here, and it's numbing the inflammatory response at the hand, and you don't perceive it anymore. Not always good. I don't like to see people suffering, but I also need to know what's going on with a patient. So what I find with pain medications in particular is people will take them and go out and keep doing their life, whatever it was that created the pain. And then they're not aware that they are doing more damage to their body. So my goal or lesson for you is to pay attention to that pain, go seek care for that pain, and maybe if you're popping pills to try and fix it, maybe try something else to address it. If you want to know more about my office, there's a link below for the website. And if you'd like to subscribe to my YouTube channel to possibly understand more, there's a link over here you can click on to subscribe.